here, nurse practitioner, owner at Functional Medicine by Well Rooted. Tonight we are live on the Functional Medicine by Well Rooted page to talk about leaky gut, some dysbiosis, and some Candida. So gut issues are definitely something that are near and dear to me, as I have struggled with them for quite some time. And so my personal story kind of has led me to have the same philosophy that I have for my patients. And I also know what works and what doesn't work and what has the best response and what doesn't have the best response. So that is something that I've been able to really hone in on at the functional medicine office. And I think everybody can attest to the fact that leaky gut or a dysbiosis, a metabolic imbalance, some sort of gut issue is such a high trigger right now in our country. And there's so many people that are struggling with gut issues but may not even realize it. And I think the biggest thing to remember, just some basic statistics, for instance, 80% of the immune system that harbors in the gut. We have some neurotransmitters that are harboring in the gut that control the gut-brain connection, if we've heard that. So if the gut's not healthy, then our whole body and our functions aren't healthy either. And for me, I grew up having lots of GI issues. I was actually on a lot of antibiotics as a child, recurrent ear infections and recurrent urinary infections, whatever the case may be, but no one actually figured out the root cause. I remember in middle school and early high school, if I would get a cold, and it would always settle in my chest, there was always just the phone call that my mom would make, and the doctor would just call in a Z-Pack. And I swear that happened once to twice a year, and it just became normal, and it became thinking of that is what we're supposed to do. And I know that they just released a huge article, which was surprising, this past week about how antibiotics are overused, misused, and people are being overtreated. So this isn't new information for us as functional providers, but it may be for others. So again, now all these antibiotics just kind of growing up caused a lot of issues, and throughout my adulthood, I didn't really notice it was a problem until then suddenly I needed my gallbladder out, and they're like, oh, that's just normal, and again, you just kind of believe it. I had my first daughter, no issues GI-wise, and then I had my son, and that was what tipped my bucket over. So easy labor, easy pregnancy, but for whatever reason, my bucket was just about to tip, and maybe just the stress of having a newborn kind of tipped me over. So then after that, I started to have a lot of GI issues. I became intolerant to several foods, suddenly couldn't do dairy anymore, couldn't do wheat anymore, and it just continued to escalate after that. And I actually was positive for IgE responses for allergens. So over time, I'm like, okay, how suddenly did this happen? Well, then I got sick in May, and I tried everything that I could. I ended up with that tonsillar abscess, for those that don't remember, about the first couple weeks after having to wearing the masks full time in the office. I ended up with a tonsillar abscess, ended up in the ER, couldn't swallow, couldn't talk. Anyways, ended up with an IV antibiotic. And after that, my Candida just kind of flared. And then I for sure knew that it was Candida. And I'd always had that suspicion, but wasn't 100%. Once I was able to hone in on exactly what I was doing and doing the functional medicine, stool analysis, and actually being able to break it down, I knew exactly how to treat it. So the whole point of this conversation is it can take years, and it could be years of you guessing and trying to figure it out. But there's so many different tests that we can do that, if we just put that effort and that time in up front to look into that stuff, then we wouldn't have to dig for years and escalate into more issues. The longer that inflammation and that dysbiosis or that Candida or whatever the case may be, the longer that's happening in the gut, the mucosal lining just becomes more thin, the permeability, the junctions are supposed to be so tight, and as what happens is they just continue to leak out, and then everything's just kind of going through. So that chicken that you're eating all the time, maybe now you're sensitive to chicken because those particles are going through into the bloodstream, and the body's releasing the antigens and they're trying to attack, right? So the body is very intelligent by design. It knows what it's doing, but it recognizes these things. So leaky gut starts as more, it may just be like I said, a stress, a toxin, some food particles, different antibiotics or medications, different pathogens, bacteria, parasites. And then what can happen is that progression just continues to worsen. So now we had all this overload, right? And so now what's going to happen is we're going to start to have bloating, we're going to start to have some food sensitivities or allergies and thyroid issues, different fatigue. I remember when I would eat gluten, when I was unsure that gluten was the problem, I would first get the stomach ache, and it would just completely make me look like I was 8 months pregnant. It was terrible. But then the brain fog, and I was instantly tired. Like, I had to nap. It wasn't even a joke. I'd have to lay down for 15, 20 minutes because I instantly just got this huge rush of fatigue. The patients that I've treated in the office for these types of things, and we pulled these away and we worked on healing the gut, they've all said that was one of the first things that went away, because you don't have that huge overload where your body's recognized it and is foreign, and it's not working in overdrive. So if it's just fighting consistently, it's just going to crash, right? So that's what we feel when we have those issues. So the brain fog, the fatigue, the digestive issues, and then weight gain. And weight gain isn't because you're necessarily gaining weight due to fat. You're gaining weight due to the inflammation that you're having. And then people are like, well, my inflammatory markers are normal. Irrelevant. So we can have systemic inflammation, and we can have inflammation due to our body recognizing it as a foreign substance within our GI tract. So there's different ways of inflammation. We have a young gal who we've been treating for about 8 weeks now, who came in. She's had some hormone disruptions, imbalances. She's very young. It kind of started after her first little one, who I think was about 3. And she's gained a lot of weight, and she can't seem to lose it. And she's tried every diet and every which plan. So finally she said, you know what? I'm coming in. I'm investing in my health. Something's got to change. We did a whole workup on her lab-wise. We fixed some of her issues there. We did an entire workup with her food and her GI tract, and we were able to pinpoint exactly what was going on. And now that she's following that protocol, she emailed me the other day. She's already lost, I think it was, I don't know, it was like 19 pounds, 14 pounds, something like that. And she's already done that on her own. It's the most that she's been able to do, because we were able to find the root cause of what was causing her inflammation. And now she feels great. She's not having joint pain anymore. She's having no fatigue, and she's losing weight on her own. So again, GI symptoms can be so much more than what you think. And that's what our goal is to try to figure out exactly what to do and how to help you. A lot of people, especially in our country, and I'm not necessarily saying in our small population of patients, but poor diet is just the biggest cause. And honestly, with everything that's happened with the pandemic, and a lot of people are eating out and they're supporting all these places, or they're busy, or they're tired from e-learning and working from home, etc. So there's a lot of guilt in that aspect, and I understand that this time has definitely changed a lot of that. But we're here to help you, find a meal plan, stick to it. We have a nutrition coach to be able to get you through it. So we need to be able to focus on those types of things to help you to get better. And sometimes it takes a team, which is why we're here for that. But the poor diet and the chronic stress, how many people can say that they have not been stressed this entire time? So not true, right? Everybody is so stressed out. And so the best that we can do is just try to help you as much as we can. But knowing that toxic burden and that overload in our body is just going to continue to escalate. So if it's not going to be, our adrenals are going to be fatigued, or our thyroid's going to start to have problems, the GI tract's going to slow down. And there's going to be a dysbiosis, and there's going to be a change in the metabolic composition within the gut. What is going to tip the bucket? So our chronic stress overload is never a good thing. And if we're feeling it as parents, I am telling you that these children are feeling it. They pick up on everything. The biggest thing, they're like sponges. They really do. They pick up on what we hear, what we feel. We've seen so many stressed kiddos in the pediatric practice, and so many GI issues that parents were like, well, we thought maybe it was anxiety or it was depression and all these things. It's like, these children shouldn't have these issues, but unfortunately they do. So how do we fix that? How do we fix the stressors and the triggers and the toxins and the diet? We can't fix all of it, but there's things we can control. And the things that we can control, like the extra medications and, like I said, the diet and the different toxins in our environment, that will help us to have a better composition within our GI tract. It's going to improve our immune system function. It's going to reduce the inflammation within the body. It's going to not put stress on our extra organs and overload, right? So there's things that are not in our control, and there's things that are in our control. And that's what we help to figure out, okay? Alrighty. So I wrote some things out about Candida. So I want to go back to Candida. So Candida is one of those things that a lot of people think they have. And I'm not saying that they don't have it, because they may. And there's so many different triggers that can trigger Candida. Like I said, from excess antibiotic use to eating a sugar that's got super high, eating a diet that's got super high sugars or extra carbs, high alcohol intake, weakened immune system, birth control can even do it, diabetes, high stress levels, again, stress. Are you catching on here? So all of this stuff can trigger that. So that's when mine actually got triggered. We actually, my husband and I decided to do a 3-day juice cleanse, which was amazing. We felt incredible, and we did lose a lot of inflammation and actually kept it off. But about 3 days later, I noticed that my stomach was killing me. I wasn't bloated, but I noticed I was having this pain. And I said, you know what, I bet you I'm dealing with some Candida. Like, this was my tall tale. Like, I just had this antibiotic in May. I've had some different symptoms that I was doing. Once I did my test and I figured it out, boom, Candida showed up, and I went hard on treatment. And within 4 weeks, I had a brand new GI tract that I didn't even know was possible for myself. So it's different when I can attest to the way I feel in my symptoms, because that's where my passion lies. A lot of what I do is from my history and what I've seen successful. But it's easier for me to say, hey, this protocol works, because I've actually gone through it and I've actually done it. So that's what worked for me, and I was able to make a program and regimen a program that I felt was better for my patients. So again, Candida can cause so many different issues, and people notice it in different ways. So if it's not the bloating, if it's not like cradle cap, which adults can get too, or crustiness, different places throughout the body, different eczema, stomach pain. Some people have what we call tinea versicolor, which is like white patches on their body. The babies, they can get thrush, which is why in the beginning I mentioned like immune compromised, those types of things with a weakened immune system for the Candida. Because after a certain age, Candida is not considered normal on the outside. While we can get yeast infections and things like that, we know that there is an issue with regulation of the sugars and the way that that's within the body, okay? So now we need to hone in on it, and we need to say, how do we kill the excess Candida, and how do we make this not flare up? Okay, excuse me. So we help you through that process. When Candida is always present, I think we need to make sure of that. Everybody's like, oh, I have Candida. We all have a yeast in our body, and it lives naturally on our skin. It lives naturally on the inside. Anything in an overabundance shouldn't exist. So for instance, when we do our stool analysis, we're looking at the entire breakdown of all the different bacteria in the gut. There should be an even amount of bacteria, not too high, not too low. Same with the yeast, right? Not too high, not too low, but balanced. So when it's overproduced, it actually breaks down the intestinal wall and it penetrates into the bloodstream, which is then we start to have all these toxic byproducts. And that's when we start to have all these different symptoms that then leads to leaky gut as well. And like I said, leaky gut's used in such a blanket term because people just, oh, I have leaky gut. Okay, well, what caused your leaky gut, and exactly what is your leaky gut? What is the precursor to that? We have people that have elevated stool tests, and we can't figure out exactly what it is until we look at the functional panel and it was a parasite, or it was a strain of bacteria that was growing that's causing all this inflammation and overabundance in the system. So we can penetrate through that, and we can actually say, hey, here's exactly what we need to do, and let's dig deeper, right? So Candida is a really goofy thing, and what's crazy about it is that it could actually change the shape in order to protect itself from harsh environments. So it responds to a shift in the temperature or acidity levels that are transformed from the rounded yeast cell. So these cells then protect themselves, and then they have the ability to actually go through the gut lining, causing leaking gut. Very, very smart. They don't want to die. So they have, picture a little yeast cell. They now can protect themselves. They can put a different cell on top and say, hey, I'm not going to respond to any temperature. I'm not going to respond to any acidity levels. I'm good. So what we do when we treat you, we're using a biofilm breaker. So we're going to give you a biofilm breaker. We're going to break down that extra lining so that we can actually kill inside the cell. People just treat the Candida, or they're thinking that they are herbs here and there, which may work, but if you're not breaking it down, they're very smart. It's not going to go away. You may feel okay for a little while, but it's definitely going to come back. Once it's in the bloodstream, it's just invading the rest of the body, and it can go from a small area to full body very, very rapidly. And we see that a lot with the little ones, especially with nursing babies, is it goes back and forth between mom and baby because of the nipples and the breast and the contact that they have. And is what happens before you know it, baby's got a yeast infection, baby's got a cradle cap really bad, it's spreading into their eyebrows, it's spreading onto their face. So how does, again, very quickly through a small body, how do we prevent these things from happening? More than likely it came from mom's gut. There was some issues there. So now it's just being exacerbated due to what? Stress, not sleeping, big overload if mom had antibiotics during pregnancy or delivery, okay? Once it's penetrated the intestinal lining and it becomes leaky, now we have more issues, right? So now let's say the Candida caused our leaky gut. We have open junctions. What's going to happen? Like I said, we're eating the chicken, we're eating the wheat, we're eating the eggs, we're eating the soy, whatever the case may be. Those particles are now in the bloodstream. The body says, invader, invader, we need to kill these cells. And so it starts invading, and it starts getting all these soldiers, and it's trying to attack, and it's trying to attack. So now every time you eat chicken, the body goes, that's a foreigner, we're going to attack, we're going to attack, we're going to attack. That's what leads to these IgE sensitivities. That's what leads to these IgE allergies, okay? So that's where a lot of people are like, if there's allergies, if there's GI issues, we need to focus on the gut health, right? So again, it's all connected, and that's what I'm trying to get at, is your issue may not be Candida. Your issue may not be a bacteria or a parasite, but we need to figure out so that we know how to help. If we are consistently doing different testing, and I'll say, speaking, I know that this video gets shared on the pediatric page as well. You know, we do a stool analysis and a functional test on kids when we feel is necessary. Not always do we have to go full guns a-blazing on these children. Less is more with kids, and their body is not as damaged as us adults are, okay? And I think we hear that all the time, or you guys hear me talk about that all the time in the office, is maybe we have 4 or 5 years of being able to figure out what we were exposed to, what antibiotics we had, what stressors, traumas, triggers, versus 34, 44, 54, 64 years, right? So if we can kind of break it down a little bit, it makes it easier. So for adults, sometimes we have to be like, you know what? We're going full force. We're digging deep. We're doing these tests because we don't have time to figure this out. We're starting to have adrenal fatigue. We're starting to have some hormone disruption. Your thyroid's shot. Your minerals aren't being absorbed. Your body is going into a nutritional deficit because it's not absorbing anything. And then people don't realize that. We'll do an IV vitamin infusion bag, and they're like, holy cow, I have not felt this good in so many years, within a day. So I'm like, exactly, this is why I don't take actually a multivitamin anymore, because my gut has had so many issues in the past that I don't absorb as well as I need to. Most of the supplements that I take are liquid or capsules, but they're different types of capsules to where they're broken down different, and then they have that biofilm breaker as well. But I do the IV bag because that's exactly what is able to help me, and that's exactly what's able to allow my body to rejuvenate and heal and give it the tools to do so. So I'll do an IV bag, I'll do some glutathione, I'll do a flush, clean out the body, do some toxin withdrawal, and then everything kind of can do its own thing. So there's not just one thing that we use to help the gut, to help the body, whatever the case, but there's multiple different avenues, and we have to be able to pinpoint that, which a lot of people ask me, and that's why I'm doing the talk tonight, is a lot of people wanted to know about the gut. They wanted to know about leaky gut and all this different stuff, and it's so broad. I can't just focus on like, this is exactly what we use to treat leaky gut. That's not the case. There's definitely some really good supplements that we can try, but as you guys know, as my patients, I'm not one to be like, here's an entire blanket of things. Everything that I give you, I can explain why I'm giving it to you. And I always say less is more. Sometimes I'll even give your body a chance to do its own thing without me having to dig really, really hard into it. So I'll say, you know what, let's try to support this for a little while, and let's see if it can change on its own. And most of the time, if we can walk it through the healing process, we don't have to go too invasive. But next week, we're going to talk about the immune system, and we're going to talk about how, on the pediatric page, so that'll also be shared to this functional medicine page as well, but we're going to talk just about the immune system and the building of that. And in that, we're going to talk about over antibiotic use and what our children are experiencing and how we can help that. we use medications. There's a time and a place to use medications. And so those that know me know that if I'm choosing to go that route, I usually mean it. I feel like there's some good justification for it. We've tried, or maybe, you know what, there's no time to kind of waste. But really, there's a lot of things that we could really focus on to say, hey, what led to what? What came first, the chicken or the egg? There's sometimes in the office we're going through labs and I say, I wish I could tell you. I wish I had a crystal ball. I wish I knew what led to this so that I could exactly just stop it in its tracks and figure it out. But sometimes we don't know that. So the big thing to kind of take home from this today is know that you can dig deeper and that you can figure out exactly what's going on with your gut. Don't, follow like Facebook groups, and don't, ask people online, and don't try 7,500 supplements, because I was that person. I remember walking into my first functional provider and I had like an entire backpack full of supplements. He looked at them all, he lined them up, and he laughed at me. I knew I was in trouble at that point. And after that, he's like, none of these work for your body. You don't even know what you're treating. I go, no, I don't. But I was told that this may work for this, and this may work for this, and I can try this. And then now that I know what I know, people do it to me all the time, and that's fine. And I say, okay, well, this was a good start. I'm glad you at least have this knowledge base. But I'm going to tell you about what each one is doing and why we're going to pull it away and why we're going to start over. So we have appointments available. Actually, I think let me rephrase. We have appointments, but we're not available till about January. We're booked out till January. So if you guys have concerns about your gut, make sure that you call. We can get an appointment scheduled. We can kind of figure out what we need to do. Some of this testing takes longer to come back. So if you're wanting to, jump on it and be like, hey, I know I want a stool test. I've been waiting on this. I think this is really important for me. We can definitely help you with that. So don't hesitate. I mean, we need to figure out what it is. We don't need to start causing more issues. We want to get that Candida under control before it invades more tissues. We want to get that leaky gut under control before it causes more problems. We want you to stay healthy. A lot of people are worried right now about their immune system and overall health and wellness. And I'll say, you know what? Our office, we've been on top of it. Like, my girls get IV bags, we're on supplements, we're staying on top of it. We really just make sure that we're focusing on our health and making it a priority. And I'm not saying we didn't before, but this year more than ever, you guys need us, so we need to make sure that we're healthy to be here for you. So if you guys need anything, don't hesitate to reach out, get your gut checked. Tune in next week for our immune system discussion, and we can go from there. Have a great one. Bye-bye.